Alright, and welcome to video 3 of our lesson 9. We are going to continue on with what T cells are. So we've kind of finished talking about B cells mature in the bone marrow. T cells are now going to mature in the thymus. And T cells can also form clones, but they do not bind to antigens that are just kind of floating around. Instead, what happens is a big white blood cell called a macrophage will actually ingest the bacteria or the foreign invader, eat it. Okay, we talked about that through phagocytosis. And then this is really cool. It takes a little piece of the bacteria or the virus and sticks it on its own cell membrane. This allows T cells to come and kind of interact with the macrophage and learn about the antigen. And this is referred to as antigen presentation. So if we look here, here is our macrophage. The macrophage has digested the antigen and stuck a little piece of it on the outside of its cell. And then we have a T cell come along, and the T cell then binds to the macrophage where it learns about the antigen that the macrophage has ingested. So there's a couple different types of T cells. The first one we're going to talk about is a cytotoxic T cell. And these are cells that specialize in killing virus-infected cells and cancer cells. So these cells will actually bind to your own body cells that are infected and cause the cell to die. It releases chemicals into it, and these chemicals enter into the plasma membrane and will kill the actual cell. So this is pretty cool. We have a cytotoxic T cell going towards the target cell, which is one of your own infected cells. So it kind of looks at it as a foreign cell because it is an infected cell, where it releases these enzymes into it, and which then causes the cell to die. Then we have helper T cells. Helper T cells act as the directors or managers of the immune system. So they're going to actually bind to a macrophage for the antigen presentation and recruit other cells to fight the antigen that it is now learned about. So basically what happens is these cells are the ones that kind of figure out what's going on. And they're going to be able to kind of start the immune response because it has learned about the antigen from the macrophage. So once this helper T cell kind of is like, all right, I see it, we definitely need to start our immune response, it's going to stimulate B and T cells to divide and also attract other white blood cells to allow them to really just try to ingest any foreign invaders. Then we have regulatory T cells. This is when now the infection has subsided and we're ready to stop the immune response. We don't need to have our immune response 24 hours a day, 7 days a week. We only want to have that immune response when we have an infection. So we actually want to stop it, and this is what that regulatory T cells do. And just like B cells, most T cells are plasma cells, and they will die in a few days, but a few of them will become memory cells and be able to respond more quickly later. So if we look here, here's kind of just an overhaul. The top is your macrophage. The macrophage has ingested the antigen and then is now presenting it to a helper T cell. The helper T cell is then going to stimulate the responses of other T and B cells to cause a huge immune response. Next, we're going to talk about autoimmune diseases. So an autoimmune disease is when your cells attack its own tissues. So basically your immune cells are attacking your own tissues. An example of this is type 1 diabetes. This is where your cells actually attack a certain type of cell in your pancreas that makes insulin. Lupus, rheumatoid arthritis, which basically attacks your joints. MS, which we've studied it in the nervous system. This is going to basically degrade myelin sheath. Graves' disease, and then glomerular nephritis, which is it's a kidney disease. So this is just some symptoms of lupus. Lupus is a very common autoimmune disease, and it comes on and off. You can be suffering from it for months and then be fine for years, and then it regresses again and starts. You usually are very tired. You have a loss of appetite. A lot of times you have a lot of inflammation. It can be hard to breathe. You have joint pain. You have muscle aches. I often see people with a rash with lupus. So what are some triggers of autoimmune diseases? One could be that, well, the lymphocytes went to school, but they didn't learn anything. So these lymphocytes are not trained properly or matured properly in being able to distinguish your own cells from foreign invaders. A second thing could be the appearance of new self-proteins. This could be proteins that kind of haven't been really produced. This happens sometimes with puberty. And in the thyroid. We also could have gene mutations that now cause new proteins to arise and causes an autoimmune response. We also can have cross reactions of antibodies. So sometimes you have infections like strep throat, and you're going to have antibodies created to fight that strep throat. But in doing so, sometimes those antibodies can backfire and also attack your own tissues. This is called rheumatic fever. So this is when you have like strep throat, and then all of a sudden those antibodies are also attacking the tissues of your heart. Allergies, the bane of my existence. And like it just says on that second point right there, rarely deadly, just very annoying. Like I stated earlier, I have a cat allergy, and I wish so bad I could have a cat, but there's just no way. So allergic to them. But luckily I'm not allergic to dogs, so I have quite a few of those. But even just grass, hay, those are all just kind of annoying allergies. And this is a very rigorous immune response that really is a harmless antigen, something that's not going to hurt us, but for some reason our body thinks it's going to. So most of us suffer from acute hypersensitivity. This is when we get the runny nose, the itchy eyes, maybe the itchy throat. And then in some cases, unfortunately, people can go into what's called anaphylactic shock. This is when you have a shellfish allergy or an allergy to bee stings. This is when the throat closes up and it's very hard to get oxygen. This is why you need an EpiPen. If you remember from the nervous system, epinephrine is adrenaline. This is a manufactured adrenaline that's put into an EpiPen that helps to dilate your bronchioles and dilate your throat so that you can stop this anaphylactic shock. So allergy mechanisms, we come into contact with an allergen, and then we have these things called mast cells and basophils, which are types of white blood cells that are just going to release a ton of histamine. And histamine is one of those things that causes the annoying runny eyes, the runny nose, the itchy eyes. Super annoying. And here's anaphylactic shock. So this is when we have such swelling now in that area caused by histamine that you just swell up. And if histamine kind of sounds familiar, that's because when you take an allergy pill, it often says an antihistamine. So histamine is one of those chemicals released from tissues and white blood cells that causes that allergic reaction. So that's like when you take a Benadryl, it says antihistamine. This is exactly what you're doing, is you're trying to basically stop the release of this histamine. Delayed hypersensitivities. This is when you get the kind of rash later, and then you have to put the cortisone cream on it. So if you come into contact with poison ivy, which isn't super common in Arizona, but my husband grew up in Indiana, and he said he dealt with poison ivy all the time as a kid. Sometimes when you use a new face wash, or you use a new deodorant, or you put on new makeup, you can have a skin reaction to it, an allergic reaction to it. Then you have to put this cortisone cream on it, which once again is steroid based to kind of help try to get that reaction back down. Immunodeficiencies. This is when we have some sort of problem with the immune system. AIDS, for example, is called acquired immune deficiency syndrome. It really does hinder your helper T cells, and that's why sometimes people with AIDS, they don't actually die from AIDS. They die of complication from AIDS. So they could get the flu, and the flu to a normal person isn't that bad. You just don't feel good for a few days. But the flu to someone with AIDS is crippling because they cannot fight it. We also have what's called severe combined immunodeficiency disease. This is when your B and T cells are not produced in bone marrow, and you need to get a bone marrow transplant. Oh wow, all right, so it looks like we're done with lesson 9. Hope you learned something. I think the immune system is incredibly amazing. It's complicated. It's just super cool that our bodies can do this. And it does it, once again, without us even having to think about it. It happens. So please rewatch the videos if you need anything or need to fill in your notes, and continue on with all of your activities. Thanks for watching.